So thank you very much to Dr. Apisamai, the assistant spokesperson for the CCSA for the Thai language version just now. We're back here with the English language summary. Today is Monday, the 20th of September 2021, and this is Natapanu Nopakun, the Deputy Spokesperson of the Ministry of Foreign Affairs and Deputy Director General of the Information Department. So firstly, Dr. Apisamai gave us some statistics and graphs which show quite a positive sign for Bangkok. Now in general, Bangkok and 48 other provinces have seen a clear decline in terms of the infections. If you saw the red graph in the Thai version, that points to that information, that data. So Bangkok and 48 other provinces are turning on a good point. Now what is still worrisome is 4 provinces in southern Thailand, as well as the situation in the prisons. Now in southern Thailand, the infection rate has been caused by mostly family members, and the death rate, fatality rate in the southern provinces is quite high. So the CCSA has given out its advisory to various government agencies, in particular this month, in terms of the various activities or meetings or gatherings, especially this month because many government officials will be retiring by the end of September. So therefore all the farewell parties and all the different activities should have to be very cautious in terms of COVID infection. Also for Bangkok, one good news is that around 7 million people, the population of Bangkok, 7 million of them have already received the first dose. Now for the second dose of the vaccine, we've reached 42% in Bangkok already, and the aim is of course 70%. So I'll move to the vaccination progress that we have for today. Accumulated total we have now is 45 million doses for the whole country. To be exact, 44,742,049 doses. So you can see that the daily number of people receiving the second dose is getting quite higher than the first dose now. It's moving upwards now, which means that we're making good progress towards the target of the vaccination campaign. Now for the general situation and daily numbers, we have new confirmed case at 12,709, and we have new recoveries at 11,125. We have active cases at 132,573, and we have fatalities recorded yesterday at 106. Currently we have, as I mentioned, a downward trend of the new cases per day. However, the number still shows a widespread infection in various clusters still remaining. So the CCSA has reiterated the various measures that are very important. Bangkok still has the highest number of infections. And in terms of the home isolation and community isolation, we have some updated numbers here. Is that yesterday we had over 300 persons in the home isolation, meaning being positive of COVID and being treated at home. And for community isolation, we have 83 at that number. In terms of the bed capacity for Bangkok and the country is more ready than in the past months. Nevertheless, preparations are being made for any resurgence of the infection. So in terms of the bed capacity of Bangkok in particular, before the Bangkok Sandbox or Bangkok pilot project begins, the beds would have to be ready for any possible resurgence in the numbers in Bangkok in particular. The beds will be prepared, number of beds will be ready for that. Now one point is about the mass COVID testing in Phuket. Firstly, I'd just like to say that Bangkok administration and Phuket province will be learning from each other by video conference this Wednesday. So the Office of the Governor of Bangkok and the Office of the Governor of Phuket will be discussing that, as Phuket was the first sandbox pilot project and Bangkok will soon be so. Of course, there are differences because Phuket is an island and Bangkok is the major metropolitan city, but the most important factor is about the preparedness plan, the contingency plan in case any resurgence of cases are seen in Bangkok, as well as the plan to scrap or cancel altogether any pilot project if the situation gets worse in the pilot province, which means Bangkok. So now for Phuket, we have launched the scheme, and since the launch, more than 30,000 tourists have arrived in the province. And since July, the number of infections were rising due to the Delta variant. So therefore, Phuket has continued with its mass COVID testing program, targeting 25,000 people in communities suspected of the source, in particular Delta variant. So this will be a 3-day active case finding operation using rapid antigen test kits, or ATK, in the high-risk areas. So the mass testing will be a tool to contain this spread, expected to be achieved in the 2 weeks. So as you can see, this is the preparedness in terms of addressing the numbers in the province of Phuket, which has begun successfully as the sandbox pilot scheme. Just a bit on the international cooperation, just to share some good news today regarding the continued cooperation between Thailand and our friends around the world. That last Friday, on the 17th of September, the Deputy Prime Minister and Foreign Minister, Don Paramat Vinay, met with the members of the Thai Chamber of Commerce. And the Thai Chamber of Commerce is donating 1.5 million baht worth of medical equipment through the Ministry of Foreign Affairs and the Thai-Myanmar Association for Friendship to the Myanmar Red Cross, with the intention to assist the people of Myanmar in combating COVID. This is another example of the assistance from the Thai private sector, always standing ready to help our neighboring countries. And since the beginning of the outbreak, Thailand has always been in touch with our neighboring countries, providing assistance and sharing expertise in related areas. So while making sure that help from the government and from the private sector will go where it is most needed. So before I end this briefing, just allow me to highlight once again that while we are now seeing a downward trend in both the number and infections, a general downward trend in Bangkok and the whole country, and of course a downward trend also in terms of the number of fatalities and fatality rate and number of infections, and that some businesses are reopening. Nevertheless, we still have to continue to follow by the various important health guidelines. The COVID-free setting is the term that is used in terms of the various businesses. They have to create a COVID-free setting for the customer's own safety as well as for the community. So thank you very much for your attention. That's all I have for today. Please stay safe and have a good week ahead, and we'll see you again on Wednesday. สวัสดีครับ